you weren't out at the bar, beating up your buddies. We lived a boring life then, right? But statistically, we're at least level with calls and going up, especially in certain areas where you have a lot of growth. You're still going to go up with calls. You have a lot of questions. Let's go.
We have the same question.
Yeah.
Can we streamline the system of submitting paperwork?
I think that's my, I think that's why people don't get reimbursed. They think the
I screw it up every single time.
every single time I get it back.
So
Every time I
And
get
I'll
it.
copy what she did so that I'm like, yours went through. No, but I'm probably like, did yours go through? And she's like, yeah. So I said, send it to me, and then I do it, and they're like, nope, it doesn't work. And I'm like, God dang it. I mean, it is not, and have to like send a mail is awkward. Like, why can't we have something?
okay, so let's
I like
work
your new
offline.
gal, I will tell you that.
Yeah.
Because she actually doesn't do it anymore.
Carrie,
Oh, Carrie.
yeah, have you been interacting with her? Our girl Carrie up there?
I have.
Yeah.
And I really like her a lot.
Yeah.
They
Push my
there's been a
paperwork
big
through.
difference
Thank you.
in emailed.
Well, one of the requests I've heard too is even just a simple fillable form, make an online form that's, so it's 2022 is all.
Yeah.
Yeah.
So I want to address your question a little tongue in cheek. You're going to get a sense of sarcasm here, but I'm being serious. We tried to bring a vendor online to automate some of this. The vendor brought a guy in who didn't listen to us. We're saying we need this path. Andrew said, I need this path to find it. He's like, I'm building you Mount Rushmore, baby. I am going to fix every problem in the world. And he took our attempt to do everything online. I think he went into a different universe. And within about a year, we were like, you're done. He was so far gone, we couldn't even bring the project back. So we said, you're done. You're fired. We're done with that part of the contract. A fillable form we can do. If that may take me some time. We don't create the forms. We have a person in our OES agency who creates the forms for us. So I can work on trying to get a fillable form. We are totally fine with everything electronic. So if you fill it out, you want a DocuSign, you want to send it to us, we're totally fine. And I'll work with Carrie offline to make sure that is. And if you want to work with Carrie, I'm more than happy to put her on an airplane and fly her down here for a day for you guys to all sit down and work out.
That would be.
That's.
We can all I'm sure, Aaron.
Chapter.
Right, see, it deters me.
Yeah.
So that's why people don't use it, and it gets bounced back every single time, and it just gets to be, and I have to say that she ended up filling out my paperwork for me the last time, because I was gonna miss the deadline, and I just didn't have time to go back to it.
So now I will selfishly say, I love Carrie. Carrie was probably the second best hire I had. Andrew was my first. It's only because he's here. I gotta say that.
I was already here, yeah.
Carrie is outstanding. All of her experience, she had no administrative experience at all. Her qualifying experience on the Microsoft Office suite was when she was in college, like 7 years ago. She managed a country club bar, private club bar. She came in and she was like, she kicked the door open. She's like, I'm here. What do you got for me? And I mean, she's got no limits. Anything you ask her to do, she'll figure it out. She's got great aptitude. She's hungry to learn. She's very customer service oriented. So thank you. It's good to hear that. And I will put her on a plane and work with you guys. So let's chat offline.
The last few I've submitted, after I've got them signed, I've scanned them, and I've had them emails, and I send them up to her and ask her to review them. If there's any issues, let me know, and I haven't got any issues back. So.
Well,
I was gonna say it was lack of training from the prior manager, but I didn't.
And the reality is I told her to put a filter on her email. Anything coming from Ron Dunn goes to trash.
But, like, maybe with my train of thought. Anyway.
Yeah.
Go ahead.
Yeah. So anyways, I wanted to cover ATA. ATA is very personal to me. We have the authority to spend money on training. So we want the PSAP to be supported. We understand your budgets don't typically support training. And the last thing, when budgets get tight around February, March, and April, the last thing your chief or sheriff wants to do is go spend thousands of dollars to send your dispatch team to a training when they have to pay overtime or buy new equipment, right? So we're trying to make this available to the PSAPs, and we're trying to make the process easier for you to get the reimbursement. Yes,
Who's responsible for figuring this part out?
the math.
Is that gonna be Carrie? Or
Carrie.
is that gonna be me saying, hey, Carrie?
She'll get that from the advisor.
Yeah, so your funding level will come from your PSAP advisor. And Janae Dabrowski, our the manager over the advisor group, just did a list of where all the PSAPs are to say, here's your funding level. Now, if you at the local, if you sit there and your advisor says, now you're funding level 3, and you pull your stats and go, no, I'm pretty heavy 4, let us know, and we'll work through that, okay? I'm not unreasonable, most of it. Yes, ma'am. I actually have her contact information coming up on a slide.
And to be clear, these are 911 calls, not
That's correct.
calls coming in, PSAP, but
Correct.
specifically
The 911, yes. Yeah. So again, I'll make this slide deck available to everybody. It is all public. Yes, sir. Okay. For $1 for you. Yeah, yeah. Absolutely. I'm not going to talk through this slide. This is a placeholder slide contact for you guys to take back. The county that your PSAP is in, that's who your advisor is. And then down at the bottom is the supervisor, Janae Dabrowski. Janae came out of a PSAP. She worked at Sacramento Police Department for like 95 years or something. I don't know, maybe 96. I think it's like 24 years she worked at Sacramento Police Department. So she has PSAP experience, and she's very passionate about this as well. So if you have questions about your funding level, that's the team to reach out to. And you have questions about reimbursement, Carrie Johnson is who you reach out to for that. And if it all doesn't make sense, let me know. We'll make sure you get a team to help define it. All right, that's the end of my slides. And I get to introduce, yes, sir.
One question.
Yes, sir.
There used to be 4 advisors. Why are there only 3?
Andrew, that's a very good question. Thank you for that. So in the PSAP advisor group, we have 4 advisors. Yvonne Nguyen retired as of the end of June. So she's a vacancy right now. And I love the state of California. I love my office. I think we do some great things, but boy, we're antiquated. So Yvonne came to us probably at the end of April and said, hey, guys, I'm going to retire in July. Submitted my stuff. So we reach out to HR and say, hey, Yvonne's going to retire. Here's all the information we need to post her position. Don't post it before, but the day she leaves, have this all approved and post it. So June 29th, Yvonne left the office. June 30, I'm asking that you post it. And they said, sure. So about mid-May, hey, where's the update? Oh yeah, when she vacates, we'll review that. We know she's vacating. Can you review it now? No, we'll do it then. She needs to be gone. Okay, but again, net zero. If you review it and approve it, you say, okay, this is done. She leaves, you post it, great. If she doesn't leave, you go, hey, at least we updated it, and you keep it for the next one. Anyways, so it'll be probably 3 months before we can get that position filled. So we've had to do a reorg. So the 3 advisors are taking on a little heavier load. We did onboard, Monday morning, we do onboard a 988 advisor. She will be joining as a part of our 988 deployment team. She has 15-ish years in a PSAP from the city of Sacramento. And when she's onboarded, we'll make sure her contact information is up there as well. Any other questions for me? Hopefully that was informative. If not, Andrew's my complaint department.
All right. Thank you, Paul.
Thank you.
Not for the information, but for going through that whole thing without one terrible joke. I really appreciate it. For those of you who know Paul, know that that was very difficult for him to do.
It was. I was trying to be professional, Andrew.
You almost got there. All right, so as Paul mentioned, I work for the technology division in 911, the assistant chief. I work with the project deployment team. So we are responsible for deploying the next gen network for California. You may want to ask, what does that have to do with 911 or 988? Well, basically, whenever anything comes in that budget doesn't really want to deal with, comes to me. So 988 is what we're talking about today. So I've been working with SAMHSA, with the feds for a few months now. You may have seen reports on your local nightly news that 988 is coming. Well, it's here. So I just wanted to talk a little bit about it today, what it means to you as a PSAP, what we're doing at CalOES, what's coming your way, and what the expectation is going to be. So up right here, we have some stats. 2020 was the most recent we could get. We're working on getting newer stats, but all of this stuff is really kind of, right now, we're in a different world than what we're used to with 911, 988. Very, very different. We're learning that. So we've got 312,000 calls that are coming into California right now. I'm going to talk about how those calls get here a little bit. We're going to talk about what the routing looks like for 988. When I say routing, I say that in quotations because it's not very good compared to what we're used to for 911. If you look, you'll see about 1 out of 8 calls in the National Suicide Prevention Lifeline originate in California. For those of you who don't know, the National Suicide Prevention Lifeline is the 1-800-273-TALK number. It's been around for forever, suicide prevention. 988 is simply the telephone company is basically putting a 3-digit number over the top of it. Same exact thing. When you dial, you get the same phone tree, same veterans service hotline, same LG hotline, same, just all the different suicide prevention lines are still there. It's just 988 now. Legislation is passing throughout the country. Each state is handling it differently, just like with 911. They're all doing different things with 988. In some states, there are dispatch requirements. In some states, there are answering requirements. Right now in California, we don't have a whole lot on the books for 988 yet. We have some legislation that's pending right now. It's supposed to be voted on in August, and I'll talk about that a little bit. But for now, it's just the number. It's just you dial 988 instead of 1-800-273-TALK. It goes to a suicide hotline prevention, crisis worker. You talk to them instead. That's really all it is today. So you look at the answer times down here. They're pretty bad when compared to 911. Right now, in the state of California, our office expects or has a standard for all PSAPs that we want you to answer 95% of your 911 calls in 15 seconds or less. As you can see here, we have an average answer rate across the country of 83%. That's just answering the call for 988 or for suicide prevention. California is a little higher than that. Our numbers are closer to 90%. That still means that 10% of all calls that come into 988 or to the 1-800-273-TALK number don't get answered, period. So this is obviously a big concern now that OES is becoming involved and they want us to manage the network and the interplay between 911 and 988. We're trying to make sure that we get this shored up. So there are 13 Lifeline call centers in California. These are the existing centers today that answer these calls. They've been doing this for a long time. They're all nonprofit agencies. They're not, government affiliated. They will probably be folded into CalOES' 911 operation. So we're working with them today to get a baseline assessment of where these centers are, what kind of call volume they have, what counties they cover. We really are starting from zero with these different agencies. So we've been working with them, doing a lot of outreach, doing a lot of site visits, really trying to figure out what their operation looks like so that we can help them out accordingly. So we'll talk through 988 technology, what it looks like right now. Today, over here, you've got your mental health crisis center. This is our version of the PSAP in the behavioral health world. They answer calls, chat, and text today. There are different carriers that bring these requests for service in. Right now, everything routes on your area code. So if you have a 916 area code, Sacramento, on my cell phone here, if I call in, doesn't matter where I'm at, call is going to the crisis center in Sacramento, Wellspace. As you can probably imagine, that's It's not a perfect system. Today, doesn't really matter. Today, it's fine because they're just, right now, it's just an expectation of getting somebody on the phone, getting some help, getting somebody to talk to through whatever, crisis you're experiencing. But in the future, the clear expectation of 988 is dispatchable mobile crisis teams. People who can go out and help and provide a non-law, non-fire, non-medical response to some of these calls, right? So where does that, how are we going to do that when you're routing on area codes? These are some big considerations that we're looking at the 911 office to try to make sure that we've got this program set to move into the future when that expectation is there. Right now, it's not there. Right now, it's just, again, like I said, it's just a pacing of 988 over the 1-800 number, but soon enough, that legislation is going to be coming to California. There will be an expectation of a dispatchable resource for these calls. So we're working on that. So this connection right here is what we're responsible for today, what OES is responsible for. The system that these mental health crisis centers use to answer these calls, it right now is a nationwide, I guess I'll call it a PBX for lack of a better term. Vibrant is the company that essentially routes all 988 calls, routes them again on area code. Calls come into what is essentially a nationwide PBX and get routed off based on area code to whatever center needs to deal with that call. Those centers today, very little interaction with 911 with the PSAP, from our understanding. We've done some outreach. We've asked a lot of PSAPs in the state of California, do you currently work with any suicide prevention hotline center, mobile or mental health crisis center? The answer is usually no. Not a lot of transferring going on back and forth. And that's on both sides. We asked the 988 centers, do you transfer to 911? And they said, not really, once in a blue moon. So right now, this connection, it's 10-digit transfer. That's all it is. There's really nothing else in place today that we can do to make this transfer any more robust, and we'll talk about that in a little bit. We do have some limited pilot project. I won't even call pilot projects. We do have some limited what I would say crisis response sort of models in the state. We have counties, cities, jurisdictions who are currently working with local mental health resources, county mental health, city mental health, whatever, to get a call in, to deal with it, to dispatch it. You may already have some sort of mobile crisis team that you're dispatching. So at that local level control, obviously that's a good thing. We're expecting that to continue. As we move into this 988 world, there probably will be some sort of expectation that you transfer to 988, but until we can get some of this routing stuff figured out, we're not changing any of this. OES, same as with 911, we're trying to approach 988 in the same sort of philosophy. We don't want to tell you how to do your job as a PSAP. We just want to give you the technology to make sure that you can do what you need to do. We'll let the politicians tell you how. So what we want to move to is a much more robust transfer, or at least a transfer of information back and forth. We want to make sure that your 988 center and your 911 center both have the ability to send information across. So what we're doing is we are setting up our mental health crisis centers with 911 call handling, essentially. The systems that Paul was talking about, the NGA and the Auto systems that we're doing the demos on, we're currently going out to RFP. We're going to treat these 13 Lifeline centers a little differently. You PSAP folks know you get a choice when you go get call handling. You just say, hey, here's a list of 11 systems or whatever. I want this one. We pay for it. These guys were starting fresh for them, so we're just basically going to tell them, here's what you get. So we're going to go out to RFP. We're going to put some technical requirements in there, a couple things that they do a little bit differently than you guys. But really, it's overkill. I mean, they don't need everything that you guys need for call handling, but we're just going to get it to them so that they have, when the time comes and we take over the network, the 988 network, we'll have the ability to transfer, hopefully with location, with any supplemental data that's coming through to either their center or your center. Because what we're seeing is it's really kind of a one-way street. The legislation that is passing around the country right now, the expectation is that 911 transfer calls to 988. If you have a call that doesn't need law, fire, medical response, it's just somebody needs somebody to talk to, the expectation is that you send that call out, or that's going to be the expectation, right? Laws aren't written yet, but right now the draft of 988 legislation that's going through says 911 center shall transfer. A little bit vague, but I mean, not the wording. Shall is not very vague, but it doesn't tell you, when or why. So the local level, your policy is going to dictate when you transfer that call. But we want to make sure that at the end of this project for us, for the 988 side, they have the equipment to get you that call with that supplemental data, or you have the ability to send that call. We'll get through the routing and all that good stuff later on. I mean, right now it's just tough because that infrastructure is not there. Like I said, we're doing the site visits, we're getting out there, we're getting them racks and circuits, the same thing that we did for you guys for next gen 911. We're putting the same thing in there, a little bit less, you know, on the redundant capacity. We're really not looking for 5 nines for these guys. I mean, I think 4 nines would be, you know, suitable for 988, but we definitely want to get them the ability to get all that information to you on a transfer and vice versa. So July 2022, we're here. It's already happening. 988 went live July 16th. Again, like I mentioned, it's really the same number when you call, but it was on the local news. It's been in the papers. It's been on the internet. I mean, I've seen it everywhere. It's here. There's still a lot of confusion. There's still a lot of people out there not really sure what is happening with this. I get people calling me, PSAPs calling me all the time saying, hey, my chief is asking about this. Are we expected to answer these calls now? Are they coming to us? What's happening? So there hasn't been a lot of communication on this. We're working through it, but it's hard. 438 PSAPs, it's hard to get out and talk to everybody. So we've been trying to get out and do as many presentations as we can, talk to as many people as we can, just to clear the air, to make sure that the PSAPs understand what the expectation is today, what the expectation is tomorrow, and what OES is trying to do about it. So, you know, the PSAPs aren't answering these calls. These calls are still going to go to the 13 lifeline centers. They're not going to transfer to you guys today. It may happen every now and then. We think that there will be a little bit of confusion just because we all know, I mean, people don't know the proper time to call 911. I wouldn't expect them to know the proper time to call 988. There's going to be some confusion there. Yeah.
Question now how my agency works. We're trying to move away from the mental health stuff. Trying to get out of this business because obviously the public's kind of spoken and police officers are not the correct people to be responding to mental health crisis. It feels like I mean, it's not a crime to harm yourself. So, and you're trying to get out of our hands, basically. So I'm a little confused on how that looks and along.
Sure. So there's a lot of agencies in the same boat, right? A lot of agencies trying to I guess sort of follow the public's will, right? I mean, they've kind of spoken. This is not moving it back towards you. This is an effort to simplify that 1-800 number because nobody remembers 1-800-273-855 something, whatever the number is. But 988 is easy to remember, right? So the expectation is the public call that number. Now, in terms of 911, if your city is moving away from, you know, from dealing with these calls or wanting to deal with these calls, wanting to move it to someone else's hands or a mental health professional, that expectation is at the local level is absolutely, you know, supported by OES. I mean, we at the state are not saying, no, you have to do really anything. I mean, we are saying we want to give you the technology to send those calls properly with location if necessary or with whatever you need to send it. But we're not saying that we want you to deal with them. We're not saying that there's any additional expectation there. What we've got here is another entity in 988 stood up parallel to 911, right? And how you guys interconnect and how you guys transfer calls back and forth and who deals with what really is decided at the local jurisdictional level. Like your city's going to decide how you deal with it. If they say, no, we still want the police department to respond to every call, well, then that's what you're going to do. Now, if there's a state law that's written that says you shall transfer a call that doesn't need fire law medical, you know, that's going to be state law, and that's what you're going to be expected to do. What happens to that caller? I'll be talking about that in a little bit. What happens to that caller? What about liability? What about, you know, there's a lot of things unanswered in the legislation, of course, right?
We have a problem where we deal with a place that's up north. I'm not sure what city it's in, and every time they get a call into their center, and I've dealt with it several times, and I apologize, I can't think of that name off the top of my head. Every time the 805 area code comes up for someone, they only call Oxnard Police. It's a huge drain. So what is the training that's going to also go into 805 covers more than Oxnard? So I feel like that's
today.
It's a problem.
Well, that's that area code routing I was referring to. And that's what we're trying to get away from, right? So Vibrant, the system that handles the nationwide 988 call routing today, is sending those 805 numbers. Well, they're coming to you, right? Because the call is going to whatever that mental health crisis center is. They're determining, well, this is actually an emergency. So let's send it off to the agency that's in, or that we have listed as our 805 contact. So apparently that's you.
But I don't even understand why any of that ever gets sent to us.
So-
I think that's my confusion, and maybe not even the proper format here, because it's still not a crime, so.
Yeah.
Police are crime driven, we're trying to get out of family disputes. Just want to clarify, like in the future.
It's a problem. No,
It's
this.
a liability, you're saying it's a liability issue, but whether or not we respond, I'll tell you what Oxford does. We go and it gets heated. We're gonna shut up shop. We're gonna walk. Sorry to say that to people that don't realize it, but that's how we do business. Because we're not forcing someone's hand, because we've gotten in shootings over these times. These things are very highly not safe for officers.
Yeah.
And they're not safe for the public either, if you're armed with something. So we will, if there is, that the only person in the house? Well, if they're armed or not, we'll leave.
Yeah.
So I just see the conflict coming of.
For sure, and there is a lot that is happening at the city, county level, the jurisdictional level that has to close that gap, right? Because you have your policies in place, and your 911 call takers, they're executing policy, right? I mean, that's their job, is to execute policy. So policy says send an officer, they're sending an officer. If the policies don't, yeah, somebody's got to deal with that. No, yes, we're not in the business of telling PSAPs how to do your job. We're not going to be in the business of telling 988 centers when to transfer. So that is going to be an issue for a little while, I feel. Right?
To address a little bit about that, this isn't coming from CalOES, this is coming from politicians, and we all know how politicians want to. We all know how politicians are. Your APCO executive board, your county board, and a few others, POA, RBF, what was it, NCOA? We all met with some legislators a month or so ago, and we voiced a lot of concerns about this 988, about the pressure it's going to put on the dispatchers. Are they going to be held accountable? Essentially, shall transfer, and if something doesn't get transferred. So it's negotiations, it's talks that we're currently having with the politicians, and we don't agree with the way the law is written. Unfortunately, CalOES was told by the governor, hey, you're going to create this, so they're doing what they can, the best that they can with what they have. Another question I had was, so we have people come from out of state all the time, especially port cities where we get these people, and it's based on the cell phone.
Mm-hmm.
Who's going to get that if it's a Chicago cell phone and they just happen to be in the city of Santa Barbara? Which crisis center is going to get that? And how are they going to know how to direct them?
They are not, Ron.
It's all going to go to Oxford.
It's all gonna go to Oxford's got it.
Right.
No, you bring up a valid point. This is something that, so I'll get to a slide in a minute here, but I was involved in a 988 sort of a policy working group. We were trying to set up some sort of best practices, bare bones kind of policy that we can hand out to PSAPs who maybe don't have a lot of resources to write this sort of stuff. Like, here's something to get you started. So we've been working on that. And scary enough, I was the 911 expert in this whole group. And so I had to explain to these people how, this is a bunch of mental health and behavioral health people, and explain to them how 911 worked. And the light bulbs that clicked on were just, it was kind of scary, because I said, okay, I got a kid. I used Northern California as an example. Got a kid who is visiting UC Davis, right down the street from us in Sacramento. Maybe he's from New York area code, experiencing some sort of mental health crisis. I don't know, calls in, call routes back to New York, right? That's where that call is going to go. Then, okay, well, now all of a sudden somebody's armed, right? Now we've got a real potential crime on our hands, or something is wrong. That person in New York, that mental health crisis center, then has to figure out how to get back to California, not only back to California, but to the correct PSAP. So there's a lot to this, right? Now, what I keep hearing back from the community, from the mental health community, is that, well, this is 2 to 3% of the calls, so we're not worried about it. Not that they're not worried about it, I shouldn't say that, but it's only 2 to 3% of the calls. Now, 911, we live on those edges, right? I mean, those edge cases are where the worst stuff tends to happen. So you want to be prepared for those 2 to 3%. So they're not really thinking about this just yet. Nobody's really thinking about this yet. So we approached Vibrant and we talked to them about this. I said, I want to see your PSAP list. I want to know where your people are sending calls. When you get a call in, I need to know so that we can sharpen it up, so we can make it better, so you can get it to the proper PSAP. And they said, well, it's proprietary. So it's a system that we have that the 988 call taker feeds in all the data that they have, and it spits out a PSAP that they send it to. Can I look at it? Can I see it? No, you can't. So we're trying to take over that process, to be honest with you. We're trying to take over call routing. I don't know if I'm supposed to say that or not, but if the legislation passes in August, and OES is deemed responsible for this network and for this call handling for 988,